Welcome to our section on oral health strategies for heart attack and stroke prevention. I think you will find this section extremely interesting and extremely current. One of the protocols that we're going to be following is what is called the Bale Doneen protocol, and this is started by Dr. Bradley Bale and nurse practitioner Amy Doneen. And you can Google them. Dr. Bale has a book out called The Heart Attack Gene. But essentially, they are leaders in preventive cardiology and the relationship to dentistry. I call them dentistry's best friend because I would imagine they could not practice medicine at all without a dentist. It's that important a component in their protocol. And Dr. Bale and Amy are currently training hundreds of physicians in this protocol. The amount of research and his clinical outcomes are remarkable and impressive, and it's kind of a foundational to what we're talking about in personalized care. This is their book, The Heart Attack Gene, a really good book for consumers, really good book. This is the Bale Doneen approach, which is essentially inflammation. We all know about inflammation, but essentially their approach is they look at inflammation as being foundational. It's the root cause of disease, and if you address inflammation, you take care of the disease, okay, and you prevent the disease. And one of the things that's unique to his approach is that oral infection is a giant component of the inflammation tree. That's why he has such a close relationship with the dental community. So the team approach here is in a preventive nature, or if a person has had a heart attack or stroke, that you just coordinate care with the primary care physician and the cardiologist. And we want to minimize the oral contribution to cardiovascular disease. Okay, we want a same protocol in that keeping the overall bacterial load in balance and inflammation to a minimum. Some patients that's more of a challenge than others. Okay, so here are some of Dr. Bale's observations, and he is really honed in on this. He feels like periodontal disease is an independent predictor of cardiovascular risk. He's gone a little bit farther than to say that heart disease is associated with periodontal disease. He feels like it's a causative factor and that will be proven in time, that a certain number of heart attacks are caused by gum disease. He's fairly certain about that. So he teaches physicians if there is a puzzling inflammatory level that they find when they do an exam and they do a blood test, they need to consider oral infection. Most physicians don't. So this is really opening up the dialogue between physicians and dentists as to the overall inflammatory approach. We can't ignore the mouth. The mouth is a huge contributor. This is a really profound, some of the current research, and I'm posting a lot of research on the website. This is the progression of inflammation in coronary artery disease. Cholesterol, plaque, a rupture, a soft plaque rupture, and then a blood clot and a heart attack. But one of the things that's happening in the research that's coming out right this minute, and I'm going to be posting a lot of it, is that this process is reversible to some degree with treatment for gum disease only. Okay, this is very, very important kind of breaking news. So our diagnostic objectives: medical history, family history, your current gum condition, and we screen for the pathogens, the bad bacteria. There's a small group of bad bacteria. We all have 500 or 600 types of bacteria in our mouth. There's a very small group of what we call pathogens, okay? We do the initial screening with video microscopy. It's very inexpensive, very simple. These are painless tests. And we look to see what the biofilm looks like, okay? When indicated, we're going to take that a step further and we're going to do an oral DNA test, and I'll show you that in a second. So here's a little illustration of a handout that we have. Here's the bacteria. Here is a tooth. Here is the neck of the tooth, what we call the sulcus, the lining. And when you get these oral pathogens, they go right into the bloodstream and right into the arteries through this mechanism right there. This is the oral DNA, advanced salivary diagnostics, and we can tell the exact, this particular bacteria that's called PG is implicated across the board in many, many different health situations, and so we can measure that bacteria. So based on the risk assessment and the bacterial assessment, we'll do some type of oral disinfection protocol. You've probably heard a dentist call something scaling and root planing, you know, where your teeth are cleaned with an ultrasonic instrument or a hand instrument. But the important thing here is we change this protocol a little bit. We're really heavy on disinfectants and antimicrobials, okay, antibacterial agents. And you're placed on a long-term maintenance program depending on your response to the initial treatment. So product recommendations are absolutely vital. You know, most of these are prescription level things, some over the counter, but the important thing is this is a different approach to a traditional type cleaning. So here's an oral disinfection with an ultrasonic scaling, different products, and the fluid, the irrigation fluid, is actually antibacterial. Home care. This is everything, and it's everything on all of these regimens. Training in daily biofilm control, pH, controlling the pH of the saliva. Xylitol is helpful, antimicrobial rinses, and the use of the floss, pick, and oral irrigation. In periodontal disease specifically, we know that patients do not floss. Statistically, 95% of people do not floss daily. So we're trying to have a different conversation. We're trying to give you different alternatives to flossing because we know flossing is kind of a dead-end road and it makes people uncomfortable. And if you've never used a floss pick is awesome. And if you've never used a water pick, these are really, really good alternatives in the oral disinfection regimen. These are some of the products, and we'll talk more about, you know, hydrogen peroxide, Therasol. There's a variety of products that we're using. And your recare interval. You know, we have to determine by measuring the bacteria and looking at the response of your tissue, is it 3 months, is it 6 months, you know, what is that interval? We don't guess. We actually create a therapeutic target and we set up an interval that works for you, okay, because there are different components. Some people have weakened immunities, they have underlying disease issues. You may have to come in once a month for a while, okay? But we test the bacteria and we treat to stability. This is a really, really important new study, the American Heart Association. This is a breaking study that I wanted to put here right at the end of this presentation. This is a carotid ultrasound, a very simple, non-invasive test that a lot of people are having to look for soft plaque in the carotid arteries. These are patients, these are actually plaque scores for patients under periodontal treatment. This is some of the new breaking research that is showing, it's leading us in a direction to say, you know what, we really need to aggressively treat these bad oral pathogens, these bad bugs that are in your mouth, because we're seeing reversal of heart disease as a result of treating what's in the mouth. So for a long time, we've had the conversation of, you know what goes on in your mouth affects your body, but we've never had the specificity to actually explain this science. That is the purpose of this website, and this is the purpose of all of these protocols that I'm creating to share with fellow dentists, is that we now can get extremely specific with our conversation, and we can point to specific bacteria that we don't want in your mouth because it affects other parts of your body.